Hey, with me we have Peter Attridge. We're going to talk a little bit about anxiety, and with a lot of the pandemic items coming up, I wanted to have Peter on. And Peter, why don't you introduce yourself, tell them who you are and what your specialty is.
Sure. So my name is Peter Attridge. I am a therapist with Holy Family Counseling Center. As a therapist, I specialize in parenting, also trauma and addictions. And I'm also writing a dissertation, finishing up my PhD at the University of Georgia in family sciences.
Great. I think one of the reasons, Peter, I wanted to do this video was twofold. I think there are a lot of people that are anxious because of the pandemic. Secondarily, there are a lot of parents right now trying to figure out whether they go virtual or whether they're send their kids to school. And I really want to see if we can help give parents tips on how can they address it, how do they feel about anxiety, little quick tips around that. I'd love to start with talking with you about, some recommendations that maybe you can provide to help parents or an individual cope with anxiety right now during this pandemic.
Yeah. So, and this is a common thing that, we see here at Holy Family, and I'm sure a lot of therapists see as well. So, anxiety kind of gets thrown around as a blanket term, right? It's just general feeling of worry, of nervousness, of unease. You can be prepping for an interview and you can feel a little nervous. You can maybe be going to a party and you can feel a little bit of nervousness or unease because you don't know what to expect. And, this feeling, anxiety is a feeling like in response to an upcoming event where we don't know what the outcome is, right? But everybody deals with anxiety differently. We all experience it, in varying forms, because we don't know if there's danger and if that danger is real, right? So this is a common thing. And anxiety can be a good thing. When we experience anxiety, if you're writing a dissertation, if you're planning a big project for work, that anxiety kind of helps you get over the hump, right? It gives you something to work towards because you want to bring certainty into your life and what you're working on. So anxiety is often perceived as negative, but it can be a really good thing as well. In these times, and I think especially what we see with COVID lately, is that there's a lot of uncertainty out there, right? There's tons of different news reports every day. The information is changing. We hear things from friends, we hear things from relatives, our kids are hearing things too. So there's all of this information coming in with very little certainty attached to it. So when we look at anxiety, there are times that anxiety can become very serious, and these can turn into anxiety attacks. And this is when the manageability and thinking just become too much, right? We can't manage what we're feeling. It's all just a lot. And this can be panic attacks can be not being able to catch your breath, to your heart palpitations being higher than they usually would. Like, it manifests differently for a lot of different people. So one thing I recommend, and one thing that I'm sure everybody has heard before who's going to watch this, is that we should practice deep breathing. And this gets tossed around a lot, but it's also a very real and very effective manner of managing our anxiety. So people, when you're breathing, when we're really excited, when your heart's beating a lot, breaths are very shallow. And the object of deep breathing is to take in deep breaths that expand the stomach out so that we can kind of loosen all the muscles in the chest and the back.
You're basically relaxing yourself a little bit before.
Exactly. So a real simple and easy way to handle this is to 6 seconds in, 6 seconds out, right? You control how fast you're breathing in, how fast you're breathing out, and that's a great way to kind of manage anxiety. Another great thing to do is, especially related to what we're seeing with COVID, and I know we're going to talk about the schools here in a minute, is to limit the intake of news coming into your house, right? So we all have our favorite news sites, we all have our favorite blogs maybe, or our favorite podcasts, and those are great, but oftentimes when you have so much information coming in, it's a really good idea to maybe limit the amount of time a day you're focusing on COVID-related items, right? So instead of having the TV on in the background for hours at a time, maybe just setting 20 minutes in the morning where you're going to listen to some quick things, and then turn it off, and the rest of the day you focus on other items. That way you're kind of controlling what's coming in. You can also go to what I call the wire services. And these are the news agencies that just report news and news only, and they don't put those little extra spins that we all like to hear onto the news, right? So AP, Reuters, some of these places, it's just straight news without any spin, so you kind of get what you need without any of the extra stuff that can help us get a little excited.
Yeah, I'll tell you that, and I think we've talked about this before. My mother found out that my brother had COVID up in New York, and very limited symptoms, flu-like symptoms. But from her mind, she was inundated with, all she watched was the news. So she ended up having a mild heart attack because of that anxiety and fear, thinking he had a death sentence, when in reality, he recuperated very quickly. So I think you're right. I mean, limiting that type of information becomes, to some extent, healthy for people.
Right.
Yeah, I completely agree. And so, Peter, let me ask a question, because I think that's a great tip. I mean, for someone as a parent, maybe who has anxiety, who's trying to figure out, how do I send my kid to school? What does a parent do first to kind of help themselves? What's another good tip that parent can use to kind of manage their anxiety as they prepare to have that conversation with their kid?
Yeah, so one great thing is if you have kids and you are married or you have a partner, is to talk about the anxiety you have with them first to kind of get it out. I'm a big fan of lists. So one thing that I do, and I try to do daily if I have concerns, is to just kind of write down what my concerns are. If it's about, my kids going back to school, because I'm in this situation too. School starts up in just over 2 weeks. My county, kids are going back to school, but the counties surrounding me, kids are going to be doing only digital learning. So, my wife and I have decisions to make as to our comfortability, right? So I write some things down, and I set aside 20 minutes a night with my wife, and we just have conversations. Sometimes it's about COVID, sometimes it's about school or finances. The conversations vary, but we have a block of time that is just us, right? And we can talk about these things. As parents, if we're able to manage our anxiety, then our children aren't going to pick up on those things, right? Or if they do, they're going to pick up on them in a healthy way. Everybody has anxiety, but kids, they hear everything. Even when we don't think they're hearing things, they are hearing things. So a lot of times, parents will have a nonchalant conversation in front of their kids, and all of a sudden the kid repeats something from a couple of days ago, and you're like, oh, I didn't know you were listening to that. So we can have these conversations as adults, and then it's really beneficial to our children to kind of share these concerns. But we just have to be mindful of what our kids are listening to and what they're going to pick up on. Right?
So how would you communicate as a parent? Because I love the creating list, having the conversation when the kids aren't there, because they do listen to everything. I have 2 8-year-olds who will call me out on anything I say. But if you're talking to a young child, a toddler versus a middle schooler versus maybe a teenager or a college kid, what's that conversation look like in each of those?
Yeah, so sometimes with little kids, it's not that they understand the complexity of what's going on in the world, right? They hear COVID, they hear coronavirus, and they know things are different, but they don't understand all the scientific minutia that comes with that. But they do understand that things are different for the family, that are different for them. They can't see their friends. So sometimes for parents, the path of least resistance is best. And what this means is ask your children what's going on. What do you think about what's going on, right? Maybe your kids go see their grandparents every other weekend and they haven't been able to in a couple of weeks. So you don't say things like, we're not going to see them so we don't get them sick, but instead we can say, we're not going to see them this week, but we will see them soon, right?
Right. Or even drive by and wave at them. That's what we did.
Right, yeah, and you can organize things differently, right? You can have virtual play dates. Although I think this many months into it, a lot of us are a little weary of the Zoom calls and the digital stuff. But kids have their own concerns that may not be the same as their parents. So sometimes it's just easier to ask them, hey, what are your concerns about? And go from that angle. With kids, especially little kids, but also with your teenagers, your adolescents, is keeping routines in place. There was an adjustment when we were all sort of working from home. We weren't able to go into the office. We got to get up at the same time. we have to, eat breakfast and then sit down to go to work. The kids need routines too, and actually kids operate really well within routines. So as much as we're able, just kind of keep these routines in place. If we're digital learning and our kids aren't going to school, just setting up a schedule. We're going to do schoolwork from this time to this time, and then we're going to have a little break, and then we're going to do something fun maybe, right? So one thing I've been asking a lot of my clients that are parents is, what are some things that you love to do when you were 8 or 9 years old that you could do with your kids now if you start digital learning? Right?
What if you're doing the on-premise teaching? How do you get them prepped for that? Because I think because you're going to have two types of kids in the school, like the kids wearing the mask and the kids not wearing the mask. And then what's that messaging look like? So first of all, people aren't being bullied, or they don't bully other kids, and they understand the difference between why maybe someone's not wearing or someone is, and what's kind of that conversation look like?
Yeah, so that's a great question. So really, that conversation should look like a family conversation, right? You and your wife may have an idea of what you want your kids to do, and you are going to do what you think is safe for you and your family. And at the end of the day, for all of us, all we can do is what is safe for us, right? So if you and your wife have a conversation, you're like, you know what, our kids are going to go to school, but they are going to have to wear masks, even if the school doesn't require it. That's a conversation you have as a family, and you explain to your kids at age appropriate levels why you think this is going to be the case, why you want them to do this, right? Yeah. Maybe it's because you're not worried about them getting sick, but maybe you have an elderly parent that lives with you, right? And you don't want that person to get sick. So it's about framing the conversation in a way that they're fully aware of what's expected of them, right? And if kids know expectations, they're more likely to try to achieve them, right? So it's not just saying, we're doing this because we want to. You give them reasons, but at their age appropriate level. I think with teenagers, what we're going to see is there's going to be more of a pushback against a lot of these ideas.
Right. No, I agree.
Yeah, and for teenagers, they don't want to be stuck at home with their parents and siblings, And so that conversation is different for them. Those conversations are more direct, right? You can help them create a realistic schedule for getting work done. That's a good thing. You can build in time for, socializing, for exercising. And for teenagers, it's a little bit different than younger kids. You really want to build in some sort of reward system for them. So, if they complete a goal, what's something fun or relaxing they can do as well after they complete that goal? None of this is going to be effective as, having kids in school and, around their peers, but it will give them kind of an idea of, this is how remote learning is going to work, and this is the structure that we're going to have in place as a family.
Yeah, I think it'll be interesting for the teenagers who are so worried about whether I call it the coolness factor or fitting in, that if I have to wear a mask and some other people are not wearing a mask,
right?
That may have I'm already anxious about this COVID thing, but now I'm also anxious about how I'm perceived in the class.
Yeah, and that's a big thing because teenagers and even young adults in college, they really value that sociability and being around their friends and fitting in with their friends. So, but again, it's making sure that they kind of understand the situation and it's explained to them. And really, it's also about just getting their point back to you, right? So we can validate our teenagers' disappointments. We can say, you know what, I know that you don't want to wear this mask. I know none of your friends are. And I know that has to make you feel a certain way, right? We should really give teenagers room to share their feelings and to listen without judging them, right? I think you and I, as adults, we probably remember our high school days and how inconsequential they were then, right? But when you're in it, when you are a teenager, this is the most important thing, right? And you right, can't be the uncool kid. So we need to give them room to share their feelings, to listen without judgment. And we don't necessarily have to reassure teenagers that everything's going to be okay, because we don't know, right? There is uncertainty, and some uncertainty is very valid. But we can just say, you know what, I hear you, and I understand what you're saying, and we're going to get through this together.
Yeah, I think you're right. It's having that conversation. First, it's important for them to understand the why. Why am I having to wear a mask and Bob's not wearing a mask? And it could be that you have an immunity system issue and we're trying to keep your dad or your grandma safe.
Yep.
So I think it'll be interesting because this is a time where not only kids, but for us, we have to be more charitable in what people are doing and their level of comfort, and we have to be flexible to that. I think to some extent.
Right.
Um, Given your, I mean, some of the things that obviously you being a practice, people come to you to talk about different, whether it's depression or anxiety, whatever it is. Um, they're, if I'm anxious, I'm not going out, and I'm not necessarily going into your office because I'm already anxious about it. What
Mhm.
do you, what, how are you guys pivoting a little bit differently to uh, change the dynamic so you can still service some of the people that have the needs?
Yeah, so initially our big push was to make sure that all of our therapists receive training in telemental health. All the different governing bodies of therapists, your marriage family therapist, of which I am, you have your professional counselors, your social workers. They all work really well with the local governments, the state governments, and with each other to come up with some foundational, telemental health requirements so that we can all continue to see our clients in the way that serves them best. And once we got that out of the way, then we just, we started following the CDC regulations and the guidelines. So, for our office now, if a client wants to come face to face, which more are starting to come back in recent months, we have our clients text us when they arrive. We open the doors for them. We have thermometers. We just kind of follow the current best practices. And the goal of that is, for our clients to feel as safe as possible, but also bring back, as much normalcy as possible. Some clients, prefer to have therapy online, and we are willing to work with that as well because, people have lots of different things to work on, and we're just going to meet people where they're at and kind of go from there.
That's exactly what my thought was when you said it, is you're really meeting people in their journey and where they're at, whether they're coming in, you're making them feel safe when they're there, and you're enabling to meet with them when they're not virtually physically there. So that's a
Right.
great thing, a great pivot that you guys made. If you were to give the top 3 or 4 tips, kind of help them with the anxiety piece being one. And I want you to give a little bit of time to talk about that survival kit or that COVID kit. Give them the quick tips and what's in that kit and how they can get to it.
Yeah, so for the kids specifically, if you go to our website, which is holyfamilycounselingcenter.com, right on our front page, we have a COVID response button. If you click that, it'll take you into a couple of different items, but we have what we call the Quarantine Survival Guide. It's an 11-page document that just it goes through some of the things that I discussed here. It has some schedules, some routine things on it. And really the purpose of it was to say, okay, we're in these quarantines. What can we do to kind of keep our routines up, to kind of take care of ourselves from a health perspective, a physical health perspective, and a mental health perspective. Really easy read, has some schedule sheets on the back. I think it's a really great document. I use it myself, so I like it a lot. As far as anxiety goes for everybody, it's always going to be a part of our lives, but it shouldn't it should not overtake our day-to-day operation. Excuse me. So, we do things like the deep breathing. I'm a really big fan of the lists. And when I'm at work, I also have what I call my distraction list. Right? So this is a notepad. Every day I have a new sheet. It says distraction list at the top. And when I'm working, if I'm working on something specific and another thought comes into my mind, I just write it down. I give that thought, somewhere to go so that I can keep on focusing on what I'm doing. And then I schedule in breaks throughout my day. And when I take a break, I look at that list and I say, okay, this wasn't important. I can mark it off, or this is something I can handle right now, and I'll go do it. Right. And this is a way of kind of getting my anxieties or the worries that come in my mind on paper. I'm not going to forget about them, but I also don't have to worry about them in the moment. Right. And so that's a good way of kind of managing what we're going through. Daily walks, if you're able to kind of do any walks or stretching throughout the day, those are a good thing. And really making sure that we get the right amount of sleep. I think, sometimes this is something that people kind of chuck to the side as not too important. TV, games, our mobile phones, they're all great things to distract us from the day. And there's nothing wrong with that. But since we're distracted, we're not really relaxing all the time. And
Yeah.
I think, keeping up a good sleep schedule, going to bed at the same time, getting up at the same time, the more rested we are, the more our bodies are able to kind of physically handle our stresses throughout the day. And I think that's a really important aspect of life that some people tend not to give a lot of attention to.
Yeah, I agree. I'm right. I was taking some notes. So I love the right amount of sleep, the minimizing the video games, exercising, creating lists. I actually, the sleep piece is so important. And it's an area that I think right now with a lot of the teenagers is a challenge.
Yeah.
My kids waking up at 2 or 3, 4 p.m. and trying to have a normal schedule doesn't really work. So it's something that we're trying to get a grasp on as we end up going back to school. So it'll be interesting. Peter, thank you so much for taking the time from your day to meet with us. I hope what we talked about here helps someone in a small way, hopefully, and certainly reach out to your organization